Results from the most recent Emerson College The Hill poll are in. The poll surveyed 1,000 likely voters in Ohio, and right now, when asked about which issue is most important in determining which way they'll vote this November, an overwhelming majority, more than 44%, are focused on the economy. It's an issue on the front of many voters' minds after a year of rising inflation and record high gas prices. 14.8% said threats to democracy were the most pressing issue on the ballot. 12.7% say abortion rights and access were their priority. And new data from the White House shows less than 5% of Americans have gotten the new COVID-19 bivalent booster released last month.
And with the colder months quickly approaching, local health leaders are urging people to roll up their sleeves. Studios reporter Caroline Moore spoke with health leaders on what changes need to happen.
The White House COVID coordinator says if most Americans do get boosted before winter, it could save as many as 90,000 lives. Now, local health leaders hope data like that will encourage more people to change their minds and get the shot.
You really should be getting this vaccine as we are heading back into our increased activity.
Dr. Roberto Colon is the chief medical officer for Miami Valley Hospital. He says the new bivalent booster is giving the country a chance to beat COVID this winter, but only if people change their minds. The CDC reports under 50% of eligible Americans have gotten their booster dose, and federal data shows most have not received the new bivalent booster. However, Public Health of Dayton and Montgomery County says since the new booster became available on Labor Day weekend, they've seen an increase in residents seeking their booster dose.
We do have them throughout some areas in Montgomery County, and particularly in areas where people may not have easy access to a pharmacy or a grocery store that's providing them. So we're trying to get to as many locations as we can and be as accessible as we can to make it easier for people to get that vaccination.
Clark County Combined Health District says the average age of persons seeking their bivalent dose in the county is 69 years old, but their appointments are filling up fast.
And it feels pretty intense right now. It's this rush of people, I think, that we're kind of waiting in the wings for this bivalent vaccine to be available. I'm sure that's going to start dropping off, but if we see cases start to tick up as we go indoors here in the next few months, I think you're going to see this demand for the bivalent kind of be steady for a while.
Dr. Colon believes the biggest challenge to getting more people boosted is fear, or rather lack of it, as many people aren't as concerned about the virus more than 2 years into this pandemic.
People lost a little bit of the fear of COVID. We don't know how long people are going to be affected, how many years those complications will be present and increase the risk for other health problems.
And coming up on 5 on 2, how health leaders anticipate the approval of a bivalent booster for kids as young as 5 will impact our local schools. In the studio, Caroline Morse, 2 News working for you.